Applied Behavior Analysis, or ABA, is dedicated to understanding learning and behavior. ABA services focus specifically on understanding and modifying behaviors that are important to your child's development. These include social skills, language, self-care, daily living skills, and much more. Functions of behavior. Behavior is often a form of communication, and it always has a purpose or a function, even if it's not always clear what the function may be. There are 4 common reasons for a behavior to be seen. 1. Attention. A child may engage in a certain behavior to gain the attention of others nearby. For example, a child may hit or shout to gain their parents' attention. 2. Escape. A child may show a certain behavior in order to get away from a situation, person, or activity that they don't enjoy or is uncomfortable. For example, a child may throw a tantrum in a crowded place. 3. Sensory stimulation. Some behaviors stimulate or dull the senses in a way that feels good to the child. For example, a child might rock or hum because it feels calming to them. 4. Access to tangibles. A child may display a certain behavior to gain access to a specific item or activity that they enjoy. For example, a child may tantrum to get their parent to turn on the TV. The ABCs of behavior. While all behaviors have a function, it's not always obvious what motivates them. It's important to understand the context in which behaviors occur by observing the child and their environment prior to, during, and after the behavior. This is known as the ABCs of behavior. A stands for antecedent. This is what happens immediately before a child exhibits a behavior, a setup or a trigger. Pay attention to who and what is nearby, where the child is, what time of day it is, and what the relation is to activities. B stands for the behavior that you observe following the antecedent. It is important to be specific about what the behavior is. Is it hitting, shouting, plopping down on the floor? C stands for consequence. This is what happens immediately after the behavior. Depending on the behavior and the purpose, what comes after, the consequence, either can increase or decrease the likelihood that the behavior will happen again. Now let's go through an example. Clara is tired and playing on the phone around bedtime when Mom takes the phone away, the antecedent. Clara starts screaming and crying, the behavior. Mom gives the phone back to Clara, so she stops screaming, the consequence. What would you say is the function of Clara's behavior of crying and refusing to give up the phone? The function of Clara's behavior was access to a tangible, the phone. Every child will have different behaviors, each with different functions and ABCs that explain them. Once ABC information is gathered, ABA providers use this information to create behavior intervention plans to increase desired behaviors or decrease undesired behaviors by modifying the consequences in a very structured and deliberate way.
Okay, Mom. This time, let's try using a different response or consequence to Clara's reaction to getting the phone taken away. We can try using a distraction, like a book she likes, in order to get her to transition to a different activity. And when she does that, we can reward her with positive praise.
Parents can use similar strategies to tackle some difficult behaviors at home while they are waiting for their ABA services to start. An ABA approach can be used to consistently reward desired behaviors, such as using language to communicate, taking turns, and many other skills that are more difficult for a child with autism. Immediate rewards, such as attention, high fives, and words of praise can motivate a child to make progress with these skills. What to expect in your ABA program. Once ABA services are approved, a board-certified behavior analyst, or BCBA, will meet with you and your child to determine the frequency of services and develop the behavior intervention plan unique to your child. You can participate in the process by sharing your priorities for goals that feel meaningful for your child's life. As your child learns and grows, so does their ABA program. Many children receive ABA services several days per week, ranging from 5 to 20 hours per week. Behavior interventionists or behavior therapists, BIs or BTs, are the members of your ABA team who work hands-on with your children to implement the goals created by the BCBA. ABA programs are very structured, and it is important for parents or caregivers to remain closely involved to make sure that everyone is following the behavior plan throughout the day and to continue working on goals even after your ABA providers leave your home. Common surprises. As your child begins a new chapter with ABA services, questions may come up. In addition to your pediatrician and ABA team, it can be very helpful to find support from community and parent organizations. We spoke with several parents whose children receive ABA therapy for autism to ask for advice or common surprises surrounding ABA therapy. These are the common themes we encountered.
At first, it may look like your ABA provider is just playing with your child rather than working on changing behaviors. However, during the beginning of ABA, it is important to build a strong relationship and trust with your child. During this initial period, your provider is collecting important information, such as what your child likes and doesn't like. This will help them determine the best way for your child to reach each goal.
In order for your child to master a certain goal, it may take many repetitions of the same technique. While this may feel tiresome, repetition is one of the best ways that children learn. It is important that you continue to work on each technique, even after the ABA session is over, so that your child can continue to progress towards their goals.
Certain undesired behaviors such as tantrums or hitting may get worse before they get better. This is known as an extinction burst, and is temporary while your child is learning a new skill.
The length of time it takes for your child to progress may surprise you. Behavior changes and development don't occur overnight, and it is normal for children to receive ABA services for several years as they learn and progress through mastering skills. It may take time, but the new skills and development your child achieves will be worth it.
Additional services. It is important to remember that there are other therapies that can help a child with autism progress besides ABA. These include social skills groups, which specifically target social interactions, speech therapy, which supports the child's use of verbal language, augmentative communication, which helps support children with limited speech, and occupational therapy, which helps with independence with daily living skills, feeding difficulties, and sensory processing difficulties. Your pediatrician and/or regional center can help your family find the appropriate services.